Hello, my name is Shah Ahmed, and today I'll be presenting a case study on ischemic stroke, focusing on James Hunt as my patient. This presentation will cover his clinical profile, neurological assessments, treatment strategies, interdisciplinary care, and prognosis. An ischemic stroke occurs when an artery supplying the brain becomes blocked, either by a blood clot forming with the vessel or by an embolus traveling from somewhere else in the body. This blockage cuts off the supply of oxygen and glucose, leading to rapid neuronal death in the region affected. Approximately 85% of all strokes are ischemic, which makes this the most common type compared to hemorrhagic strokes. The site of injury strongly influences the patient's presentation. When the left hemisphere is affected, patients frequently develop right-sided weakness and language impairments, as we'll see in James Hunt's case. Beyond individual impairment, stroke is also a leading cause of long-term disability worldwide and causes a major burden on health systems, families, and carers. As a result, the need for interventions and ongoing rehabilitation remain urgent. James Hunt is a 68-year-old retired engineer who experienced a left hemispheric ischemic stroke 2 months ago, confirmed by MRI. His past medical history is significant for hypertension and type 2 diabetes, both of which are well-established vascular risk factors that increases likelihood of stroke significantly. Clinically, James presents with several hallmark features of a left-sided infarction. He has right-sided hemiparesis or weakness affecting both his arm and leg. He also demonstrates mild expressive aphasia, which makes it difficult for him to find words and communicate effectively. Neurological examination further showed impaired proprioception, meaning he struggles to sense the position of his limbs, and hyperreflexia in his right arm and leg, which is consistent with upper motor neuron involvement. These impairments have also become significant functional limitations. James now struggles with daily tasks such as dressing, eating, and moving safely around his home, leaving him far more dependent on others when compared to before his stroke. More importantly, he expressed frustration and anxiety about his loss of independence, which highlights the psychosocial burden of stroke recovery. An ischemic stroke develops when a cerebral artery is obstructed, most commonly by a thrombus forming on an atherosclerotic plaque or by an embolus that travels from another area, such as the heart. This blockage prevents oxygen and glucose delivery to brain tissue, leading to cellular failure. Within minutes, neurons deprived of energy begin to die. The process is further accelerated by excitotoxicity, where excess glutamate and calcium ions accumulate and damage surrounding neurons. In James Hunt's case, the lesion occurred in the left hemisphere, which contains the motor cortex and corticospinal tract. This directly explains his right-sided weakness and hyperreflexia. Involvement of language areas such as Broca's region also explains his mild expressive aphasia. Beyond the initial ischemic injury, secondary mechanisms further the damage. Neuroinflammation, oxidative stress, and breakdown of the blood-brain barrier all contribute to further neuronal loss, limiting recovery potential. These mechanisms highlight why early recognition and interventions are vital in reducing brain damage and improving functional outcomes after stroke. James Hunt's clinical presentation reflects a classic pattern of a left hemispheric ischemic stroke. He demonstrates right-sided hemiparesis, which arises from damage to the motor cortex and corticospinal tract on the left side of the brain. This explains why his weakness is contralateral to the lesion. He also experiences mild expressive aphasia, which is consistent with involvement of Broca's area in the dominant frontal lobe. This makes word finding and sentence construction challenging, although his comprehension remains largely intact. In addition, James has proprioceptive and coordination deficits, meaning he struggles to sense the position of his right limbs and to perform fine motor tasks. Neurological examination revealed hyperreflexia in his right arm and leg. This is a common symptom of an upper motor neuron injury, reflecting the loss of inhibitory control normally exerted by the corticospinal tract. Together, these impairments significantly limit his ability to manage activities of daily living, such as dressing, eating, and walking safely, highlighting the profound impact of stroke on independence and quality of life. James Hunt's impairments were quantified with 2 clinical scales. The Medical Research Council, or MRC scale for strength, showed that on his left side, scores were between 4 and 5, which is close to normal. However, on the right hemiparetic side, all scores fell between 2 and 3 out of 5. For example, his shoulder and hip flexors both scored 2, while his wrist and knee extensors reached only 3. These results indicate that while James can move his right limbs against gravity, he cannot generate any resistance, reflecting moderate to severe weakness. More importantly, he did not score higher than 3 on any right-sided muscle, confirming the extent of his hemiparesis. The modified Ashworth scale, which measured spasticity, showed scores between 2 and 3 across multiple joints. For instance, his right elbow flexors and knee extensors scored 3, which means considerable increases in muscle tone that make passive movement difficult. Other muscles, including his wrist flexors and hip flexors, scored 2, showing a marked but more manageable increase in tone. Together, these findings highlight the weakness and spasticity on James' right side. They confirm why his function is so restricted and provide some essential baselines that can guide physiotherapy interventions and allow his progress to be measured over time. Physiotherapy is central to James Hunt's recovery, and the evidence strongly supports early, intensive, and task-specific rehabilitation. One of the primary goals is motor retraining. For James, this would include repeated sit-to-stand practice, gait re-education, and step training. These interventions are designed to stimulate neuroplasticity and help him relearn lost movement patterns. Strengthening and balance training are also critical. Given James' right-sided weakness and proprioceptive deficits, these strategies not only improve his mobility, but also reduce his risk of falls, which is already increased by his poor choice of footwear. Spasticity management must also run alongside strengthening. Regular stretching, correct positioning of the affected limbs, and encouraging functional use of his right arm and leg can all help to reduce tone and prevent contractures. For upper limb recovery, constraint-induced movement therapy can be valuable as it forces engagement of the weaker limb and counteracts the habit of non-use. Finally, education is a vital component of physiotherapy management. James and his carers should be supported with guidance on safe transfers, gait aids, appropriate footwear, and strategies to gradually regain independence in activities of daily living. This multifaceted physiotherapy approach is backed by research while being tailored to James's impairments, thus improving his chances of a meaningful recovery. Medical management also plays a vital role in supporting James Hunt's recovery and preventing another stroke. Antiplatelet therapy such as aspirin or clopidogrel reduces the risk of recurrent ischemic stroke by preventing clot formation. Statins are also recommended as they're not only lower in cholesterol, but also provide additional vascular protection, which is especially important given James's history of hypertension and type 2 diabetes. Careful regulation of blood pressure and blood glucose is also essential, as poor control of those comorbidities would further increase his risk of another vascular event. In addition to this, spasticity may be partly managed with pharmacological agents such as baclofen, which can help reduce tone when used alongside physiotherapy strategies. In summary, medical treatment complements the physiotherapy treatment plan. While medication reduces vascular risk and manages secondary complications, physiotherapy restores function. Together, they create the foundation for James's rehabilitation and long-term independence. James Hunt's prognosis depends on several factors, including his age, comorbidities, the extent of his lesion, and how consistently he engages in rehabilitation. At 68, with hypertension and type 2 diabetes, he faces a moderate risk of stroke recurrence, and his overall recovery may progress more slowly compared to younger patients without comorbidities. Despite these challenges, there are positive indicators. James has preserved cognition, which means he can fully participate in therapy. He has also engaged in physiotherapy early, which is a key predictor of functional recovery. With ongoing intervention, improvements in mobility and independence in daily activities can be set as a realistic goal. However, it is likely that some degree of residual weakness and expressive aphasia will stay long-term. More importantly, his care must involve other allied health professionals. Occupational therapy is essential for supporting James with activities of daily living. This includes practicing self-care skills, introducing adaptive equipment such as modified cutlery or grab rails, and recommending home modifications to reduce falls risks. Speech pathology is also critical for addressing his expressive aphasia. A speech therapist would provide structured language retraining, introduce strategies for effective communication, and where necessary, trial augmentative communication devices to reduce frustration. Alongside this interdisciplinary care, research continues to advance rehabilitation. Robotic-assisted training, constraint-induced movement therapy, and neuromodulation techniques are showing great promise in enhancing neuroplasticity and improving functional outcomes beyond conventional therapy. Together, these approaches provide a realistic yet hopeful outlook for James's recovery.